Dr. Brett, Advanced Pain Centers, and we're going to tackle another common question that we get in all the clinics quite often, and that's, when should I be worried about my child's posture? So, first of all, for many kids, the muscles are not developed well enough that we really need to be too concerned, especially getting up to nearing the teenage years. So when we see them slightly hunched over or shoulders slightly rolled in, I have to talk parents off the ledge when it comes to posture for this. It's really not, it's usually self-correcting in many cases, but I'm going to get to a few exceptions with that and some things to look out for that maybe are a little bit more of a red flag. So, when should we consult somebody, or when should we should be more concerned? There's a few. One is if there's an obvious bend when you're staring at the back. So if you're looking at the back of your child, and by the way, this actually applies to anyone, but if we're talking about our children, you stare and there's sort of this obvious bend. This is something you may want to have checked by a professional. Shoulder height imbalance, the same type of thing. So you might notice that one side is higher than another. There can be a slight difference in all of us, and that's not as big a deal, but if there's something quite obvious. Long-standing neck or back pain, or feeling tired all the time. So just feels sore, tired, and not just after a day. It's just this chronic thing. This is something that you may want to look at consulting somebody to look at. And then if someone has chronic headaches, their child is getting these tension headaches, a lot of stress at school perhaps, or times when exams are there and there's headaches, or even when it's not especially, that's kind of a red flag.